Welcome, everybody.
Listen, thank you all for being here. This is another episode of Let's Talk Health. And today as you know, I have a bias, and my bias is the body is a battery, and we die because we're no longer able to energize the battery, and we use food and other things to do that. And the other thing is you only have control over one thing, and that's what you put in your mouth. And what goes in your mouth is as important as what comes out. So today we're going to talk with Leona Meditz, who has written a book on the oral microbiome and all the kinds of things that can happen inside your mouth, which is where the journey begins. It's where the journey begins. So, Leona, tell me what's happening. Tell me what I can talk to you about. You introduce
Well,
yourself.
we have no problems, Harvey, knowing what to talk about. We can talk for hours. But for today, I wanted your guests to understand a little about what's going on in their mouth and how they can improve the health of their mouth by what they eat and how they take care of their home care. So you're right. I wrote a book, Diffuse the Dental Implant Time Bomb. And it's about if you don't do the things we're going to talk about, and you put a implant in your mouth, you have a 30% chance of losing it if you put it in a dirty mouth. So getting your mouth cleaned up before any dental surgery is highly recommended. You'll heal better. Your surgery, the materials will stay better. They'll uh, connect better into the body, and you'll just be healthier all the way around. So the first thing I wanted to talk about was what is this thing called oral microbiome? Because we're hearing it thrown around a lot. And it's simply a community of about 900 species of bacteria in the body. And there are 11 of those that cause periodontal disease. Periodontal disease, 70% of Americans have it. And if you have it, it doubles your risk for heart disease, diabetes, preterm birth, Alzheimer's. The list goes on and on, cancer. So to keep your mouth healthy will also help your gut to stay healthy. So the body's connected. The mouth is not separate from the body. So those you can actually measure those 9 microbiomes. You can go to the Meditz, MEDITZ method.com, and you can go in and download the oral DNA test, and it'll show you how your dentist can measure your those 11 bacteria. We only really care about the top 3 because bacteria is opportunistic, meaning that when you get rid of one, another one takes its place. There's a limited number of rooms in the inn. And so when one leaves, another one moves in. And so when you're talking about the top 3, you're talking about the AA, PG, and TD bacteria. And that'll be on that chart when you go to the medicsmethod.com and look up bonus, and you can get your bonuses downloaded. So that's one of them. So the first thing to understand is there's good bacteria. There's more good bacteria in your mouth than bad bacteria in your mouth. But the bad bacteria changes your health dramatically. So controlling that without hurting the good bacteria is really important. So do you think they want to know how to do that?
Yes.
Okay. So if you have any questions, you can interrupt me, by the way.
Okay. Well, and we'll let the people do that too, because I'm sure this is something that is not an everyday knowledge.
It's not.
I certainly didn't know about all of this until just recently, and I've been studying this a long time. I knew about dentistry and things like mercury and heavy metals and what goes on in your brain, and uh, but not about how you have to keep it clean. That's new.
Yes. So to keep it clean, there's four things you can do. The first thing to do is talk to your dentist and ask them the last time your hygienist measured your mouth, measured your pockets, they call them. It's actually gum tissue damage, but ask them how many pockets that you had that were over 4 millimeters. If they're four or more, I'm sorry, that if they were over 3 millimeters, if they were four or more. And you shouldn't have more than six. So you're healthy if you have six or less pockets that are under four or less. Okay, so that's the first thing to do is find out how healthy you are. And if you're part of the 70% of the population that has periodontal disease, you're going to be shocked at how many that you have that are greater than four. So then now what do? Well, the next thing you do is find out if a deep scaling and root planing is recommended for you. Nobody wants to get it. It costs money. Insurance covers a part of it. It's going to cost you about $1,500 to get it done. But the reason it's there usually is because you didn't get your teeth cleaned thoroughly on a regular basis, or it's just built up because you haven't brushed your teeth regularly.
I have a question, if I could interrupt you. Feel free, other people, because I have lots of questions about dentists. Um, is you were talking about pockets? Is that when they take their little sharp pointer thing and go through and measure?
Yes,
And so it's if it's more than four. What about if it's like three? What if they do 4, 3, 2, 1?
that's good. Not four is not good. 3, 2, 1 is good. So if they measure six sites around each tooth.
Right.
So if they measure three on one the front and four on the back, it still counts as a four.
Got it. Okay. Thank you. And
Welcome.
and this is something that if you actually have, if you do reasonably good oral health, like brushing, uh, water
Flossing,
picking,
right.
and you do that a couple of times a day, um, and you get your teeth cleaned on a regular basis, you shouldn't need the deep cleaning thing.
Right, exactly. But if you do get it done, because that deep cleaning is the only thing that'll take plaque away.
Right.
So plaque is the buildup of the it's the buildup of the bacterial waste that so bacteria. The reason people have bad teeth, bad breath when they have bacteria in their mouth is because not just because of what they ate for dinner, but that can be. But most of the time, it's because of sulfur. It smells like sulfur. The reason it smells like sulfur is because sulfur is a waste product of the bacteria. So basically, that builds up, hardens, and deep cleaning is the only thing that'll take care of it. But while you get the deep cleaning, also find a dentist that either does laser assisted periodontal therapy, LAPT, or LNAP, LANAP, and there's a difference, and I'll tell you in a minute. And then also, if you or if they do ozone. Now, ozone does not remove plaque, but ozone kills bacteria. So when the hygienist is messing around in there getting that plaque off, that bacteria is going right into your bloodstream. So you should be killing that bacteria with either ozone or the laser. And the laser will remove plaque. And so that's why I like the laser too. It helps the cleaning bit go better. It also
Okay.
numbs the area better. So laser, whether it's LAPT or LANAP, I prefer LAPT because hygienists can do it easier. LANAP is a hotter laser, and really a dentist should be the only one that uses it. There are hygienists that use it, but you take a chance of burning the patient. So I like LANAP, I mean LAPT better. And also I like ozone. So they do that before they get
How,
the cleaning.
how do they do the ozone?
Well, in a dental office, they have a machine that creates ozonated water, and that ozonated water they put in the mouth, and that ozonated water kills the bacteria. You can get ozone water containers and make your own and take it, at home, but it's not as strong. It can't be because they got to be careful that it's in the right parameters so that it's safe for the public. But you can use that to help keep your mouth clean in between cleanings. The other
We
thing that, go
go ahead.
ahead.
No, you go.
So you have, find out what your pockets are. Get a deep scaling and root planing or deep cleaning, they call it, if it's recommended, because that will start you with a fresh mouth. But don't let them do that without using ozone or laser. If your dentist does not use a laser, find one who does. You can still go to them for crowns and bridges, but don't go to them for your cleanings. Okay, go to somebody who's up to date enough to have a laser. It's not new technology. So do that and then change your home care. And because whatever you're doing, if you've got more than 6 4 millimeter pockets, it's not working. So what should you change it to? Well, that was my question as I coached over 200 dentists throughout the country. What do I change them to? Because I was a distributor of a very popular home care product for dentists. And when I found out, I did case studies and I found out it didn't work. It wasn't working as it was touted to work. And so I wanted 3 things to happen in the home care. I wanted, first of all, the bad bacteria to be killed, the good bacteria not to be killed, and I wanted it to be all natural. I didn't want any drugs or chemicals in it. And so I developed Clean Kiss. And if you go to Clean Kiss, clean is in not dirty, kiss is in smooch, go to cleankiss.com. You can see the products there. And there's basically mouthwash, toothpaste, and 3 nutraceuticals. Now, nutraceuticals, you don't have to do those at first. You can just try to change the home care. And what you do is you brush for, you swish first because the swish oxygenates the mouth, kills the bad bacteria hate oxygen. Good bacteria love oxygen. So by putting an oxygenated mouthwash in your mouth, you're promoting good bacteria while you're killing the bad. So you do that first, then you put a little bit of the mouthwash into the oral irrigator, your water pit, and go around and get it because it goes under the gum line that way. Now the only problem is you have an acidic mouth. And in order to really keep the oral microbiome balanced, we need a basic mouth. And so one way you can have a basic mouth is to eat basic foods, eat foods, that oxygenate, eat foods. So diet has a lot to do with this. This isn't any magic bullet. There's several different things you can do, but with the home care, if you do the mouthwash first, oral irrigator second, toothbrush third, because the toothpaste is basic. So when you brush your teeth with the toothpaste, you walk away with a basic mouth. And that's really good for your teeth enamel.
Is that why they use baking soda in some of these things?
My toothpaste has baking soda in it. And the reason why it's makes it pH balanced, but it's also lowest on the abrasive scale. There's all these fad toothpastes that come out, and one of them had charcoal in it. Well, it's just ripping the enamel off the teeth. And so you got to protect that enamel while you're cleaning it. And baking soda does that just fine. You can use baking soda to brush your teeth with, and not anything else, but you're not going to have the bacterial fighting components of it. You're not going to have the 13 essential oils that are in Swish. You're not going to have the apple cider vinegar that kills the bad bacteria, or tea tree oil that kills the bad bacteria, or aloe vera gel that heals the mouth. You're not going to have all of that. But you can just dip your toothbrush into baking soda and clean keep the plaque from forming with that. It's a good tooth whitener too. But then, so that's your home care. And then it depends. If you're on medicines, if your diet isn't the best, if you're got dry mouth where you're sleeping with your mouth open, if you uh, are overweight, those aren't going to be. That's not going to be enough. The mouthwash and toothpaste is so good that I guarantee it works. You'll get better. You won't get perfect. It won't totally put it in remission all the time, but it will improve your oral health, or I will give you your money back. I've yet to have to do that since 2014. It works out well, but it may not be enough to get you totally in remission. We can't cure periodontal disease, but we can put it in remission forever. And so you might need some support. And so there's 3 nutraceuticals that are double-blind studied. They were studied by the University of Loma Linda. And one of them is called Periotherapy, one is called Periocare, and one is called Osteotherapy Plus. Osteotherapy Plus is for bone health. So it's good for anybody that wants bone support. If you're going to get an implant, you better have bone support. And then if you have the periotherapy, you only use for 2 months. And the reason is because it has echinacea in it. And echinacea is really good at killing bacteria and getting, it's a shot of getting the mouth healthy, but you don't want to use it long term. So you use Periocare after 2 months, and you can use that as long as you want.
Maureen, let me say one thing, and then I'll get to you.
Sure.
If you think dentists are expensive, you ought to see what periodontal care costs. Anyway, what's your question, Maureen?
Leona, I heard you ask or mention essential oils. Can you expand more on essential oils
Yes.
and oral care, please?
Yes, absolutely. Thank you for the question. Essential oils are very, they oxygenate the mouth. And as I
Do you have
said,
any that you can recognize or that you can recommend, pardon me? Essential
well,
oils?
there's 13
Oh,
essential oils in the mouthwash. So it's not any one, and it's in a special formula. So
so
it's a
you sell
toxic.
this mouthwash then?
Yes, at cleankiss.com.
At where?
Cleankiss.com.
Clean
Clean
Kiss.
is in not dirty, kiss is in smooch.
The clean is with a K or a C?
See, spelling.
And is that US then?
Yes, yes, and it's made in the U.S. It's made at a uh, approved lab, a FDA approved lab. But even though it doesn't have to be, but I sell it through dentists, and so in order for them to be able to carry it, it has to be approved by FDA. So it is.
Is it available up here in Canada through any dentists? I'm from Canada.
It's not sellable in Canada. I'm sorry, I apologize.
I can't get it in.
You can't get it in Canada.
Okay.
Canada would I'd have to pay $30,000 for them to just evaluate
Oh,
their FDA. So
yeah, and it's
if
yeah.
you have a lot of Canadians can go across the border and have a PO box across the border and get it. But
That's a long ways for me across the board.
Or you can find a friend in the United States, and they can order it and send it to you.
Oh,
yeah,
okay.
yeah, it's
I've done that before, and friends in Canada have done that for me.
yeah, I have a client in Canada and I'd love for her to use my product because she does everything else, but she just, whereabouts in Canada are you?
I'm in central Alberta.
Okay.
She's
You
really
can't,
hardy.
yeah, you're too far away for her. So
And where is she at?
she's in, I just lost it. She's close to, um, on the west side of Canada. She's close to Montreal.
Okay, that's definitely not west side of Canada.
Yeah.
No, Montreal's east side.
East side. What's the other
Very
one?
east.
I'm sorry, I don't know. I've lost where she's at, but she's it's
Victoria.
no, I don't want to take time to figure it out. It'll come up and I'll tell you.
That's one thing you know, as you get older, the train is always going to come around again.
Yes, exactly, it is. And I've never been good on addresses and that kind of thing. It's nothing to do with age. I've never been good at it. Her name is Dr. Ivy Yu, Y-U. And you can look her up if you're interested to see if she's close to you, but I don't think she will be. So that's the home care part that you can do. And you can measure if the body, how well the body is accepting the, how well the body is accepted, how well you're doing by doing 3 finger stick. You can do a finger stick for 3 different tests. And yes, that's only in America, in the United States too. And you can get them at cleankiss.com. And there, it's 1 finger stick, and you will find out your A1C, your CRP, and your vitamin D. Now, my Canadian doctor, she does it through the medical system, will do the test for her. So they just request it from the physician. But the reason those tests are important is because the A1C tells you how much leftover sugar you have in your bloodstream. And if you have too much leftover sugar in your bloodstream, then it can be caused by periodontal disease. Not the only reason. It can be caused by diet. It can be caused by all different kinds of things. But nothing puts the body out of whack more than a bacterial infection. A bacterial infection is the #1 cause of of inflammation, and inflammation is the #1 cause of systemic disease. So it could be all kinds of things, but we want to look and see if you have this bacterial infection in your mouth first, and then we can go from there. So A1C is important. It should be 6. And if it's more than 6, you're typically pre-diabetic, or if you're in the 7 ranges, you're diabetic typically. I can't diagnose, so I'm not diagnosing you, but that's the typical standard. And then you have the A1 CRP. CRP is C-reactive protein. And C-reactive protein is formed in the liver when there's inflammation. Any kind of inflammation, not just periodontal disease, but any kind of inflammation. Then it goes into the CRP is formed in the liver, and you can measure that. And this research that's been done on CRP, and when you go to themeditzmethod.com and you go to bonuses, you can get, there's 5 bonuses, and one of them is you can see the A1C, CRP, and vitamin D information. And so it's a good place to go for information after this podcast. You can also go to either cleankiss.com or themeditzmethod.com for any kind of blogs. I have a lot of blogs. So at any rate, CRP was done by Dr. Ridker, Ridker, and he said he could tell by the levels of CRP how much risk you have for a heart attack. So that graph is in the bonuses in themeditzmethod.com. And the amount of, so for example, if the healthy is 1 milligram or less of CRP in a liter of blood. If you even have 3, let's say 3 milligrams, the doctors don't get real upset unless it's 3 or more, because that's serious. But 3, for example, if you had 3 milligrams per liter of blood, you'd have a 300% chance of a heart attack within 10 years. If you went to 5 5 milligrams is 500%. So you want to watch your CRP. People used to poo-poo that. They're not anymore. Allopathic physicians used to poo-poo CRP, and they're not anymore doing that. They're paying more attention to as a marker, not as a diagnostic tool. It doesn't tell you what caused the CRP to happen. It just tells you it's there. And then the vitamin D, D3 is really important, especially if you're going to have any kind of surgery involving the bone of involving your teeth, extracting them, replacing them, any kind of crowns, whatever. You want strong bones. And so you want to find out what that is. And the test will tell you. It'll be green if it's good. It'll be yellow if it's in danger. It'll be red if it's bad. So you can find that out for yourself or go through your doctor.
Well, the scan that Dr. Grant and I use, the AO scan, the resonance scan, it will measure HSCRP.
Good.
And if it shows up, that's not good.
Yeah, good. That's right. And for the reasons that I just said. So I'm glad you're measuring. I didn't know that. That's awesome.
It measures the inflammatory markers. The sed rate can show up. CRP shows up. And there's another one. Dr. Grant can talk about that.
Yes, Dr. Harvey, we definitely can measure HSCRP. We can measure myeloperoxidase. We can measure homocysteine. We can measure galactan-3. All of these inflammation marker, as Leona was talking about, can be measured with 98% accuracy via virtual voice scan through the voice energy, voice frequency, voice vibration from anywhere in the world at 98% accuracy. So contact Dr. Harvey or myself to do this test, and it's just, you'd be amazed how accurate that is versus blood test and MRI and PET scan, CT scan, ultrasound, 98% accuracy done. In less than 40 minutes, you get 400 pages of accurate reports to detect inflammation, to detect infection, to detect how healthy is your microbiome in your mouth and in your gut. As Dr. Harvey talks about, gut health is brain health, is oral health, gum health, bone health. Everything is starting in the gut, as Leona was talking about. So I fully agree with that, Dr. Harvey. Everybody should be doing the virtual voice scan. Yes.
Thank you, Dr. Grant. Yeah, Maureen?
I love this idea. There's probably a cost, and I'd love to know what I look like in that scan. I just have a question.
Why don't you contact me afterwards and we'll
okay.
talk.
I do have a question though, and just something to put out there, and maybe you don't even have the answer at this moment, but something to consider. I have a rare connective tissue disorder, and I live with inflammation all the time. And yes, it does affect my gums because the collagen in my body doesn't know because genetically my body doesn't know what to do with collagen. I guess that's the easiest way to say it. So yeah, I am adamant about my oral health. I get my gums and my teeth cleaned every 4 months. And no matter how often I do it and how well I take care of it, my gums still continue to bleed because of the connective tissue. I don't have any bacteria, and I mean, I floss. I can feel in the plaques on my teeth. It's gross.
It's the inflammation, and that's what we treat. I can tell you that back in 1991, when I first started treating chronic pain, chronic fatigue, no, I started that in 1985. By 1991, I figured out it was all due to inflammation. And so everything had to be geared toward inflammation. So we have protocols that can help that. And I myself, I had a progressively degenerative neuromuscular disease that my friends down at the medical school, and one of them actually ended up working for me in 1995, but in the medical school in 1979, he said, quit going to doctors. Nobody knows what's wrong with you. There is no treatment. And try taking these vitamins. Well, I was already using vitamins and minerals to treat brain injury. what you would call brain injury in small children. So I started using that, and what I was able to do was slow down the progression. Now, I know now that it was linked to glucose spikes. We didn't know that back then. I had to wait until I became a diabetic in 1996. But I was having these all along. And there was a genetic part to this. The genetic part was they were what we call a psoriasis. That they were psoriatic arthritis. There was
Yes,
that.
familiar with that, yep.
And what I had was the muscle part of that. Because
Oh,
when I
okay, yeah.
started doing my research, it always led to they told me you got something with my
Polycystic
muscles.
fibrosis?
No. Polyneuritis. My muscles were chronically inflamed.
Okay.
That's what it came down to. And they were always moving, which is why I had sarcopenia when I was around 40, but nobody ever told me that because they didn't know back then what they know now. And that's why they told me you're going to end up in a wheelchair. And when he came to work for me in 1995, I said, "Hey, you remember you telling me that way back when that I was going to be in a wheelchair in 5 years? Well, you should have shot me." Well, why would I do that? You didn't know. You were at least honest. I said,
Yeah,
quit going to
exactly.
doctors. They don't know what's wrong with you. And they don't. Because they'll just say that's the damnedest thing I've ever seen. When I played racquetball, and after 15 minutes, my muscles were limp. I could barely walk. And then I'd go sit in the steam for 45 minutes and I'd be okay. And I go, you know what's wrong with me? No, but that's the damnedest thing I've ever seen. So, you know, the problem is you can have these undiagnosed problems, and that is what leads to your increase in A1C. And just because you're controlling your A1C does not mean you're controlling the inflammation.
That's why the two tests are important.
Right.
Maureen, you bring up another question that needs to be answered, and that's which comes first, the periodontal disease or the other things that are wrong with your body. So, you know, which comes first, because they're interrelated. And so the only thing that I would recommend for you is just make sure that your mouth is as clean as you can get it, because the tissue, that bleeding, if you need to do an oral DNA test, and I think they can do those in Canada, oral DNA tests.
I'm sorry, I have a really important phone call I have to take. I apologize.
Okay, get yourself an oral DNA test, and if those, she had to go. Okay. Maybe you can let her know, because you're going to contact her anyway, Dr. Harvey, that
Right.
she needs, it's an oral
I
DNA.
will. She may be back when the phone call is over.
Yeah,
But
and it'll make sure that the pathogens, the bacteria, the periodontal pathogens aren't contributing to her problem. So, and there's other things too dentally to take into consideration, and to hold your thought, because I want to hear it. The first one is malocclusion. If, you know, the way your teeth fit together can cause stress, and that stress can cause the teeth to loosen, which causes pocket depth. So, you know, malocclusion is really important. Make sure that your teeth are fitting well together, that your bite is good. Another one is the lack of vitamin D. And the third one is the periodontal pathogens. So those are the things that you want to look at dentally.
you know, it's a shame. My wife had dental surgery yesterday, and it's a very long story. But basically, she said she had a bad tooth, so she was going to get an implant. And we did this in 2020. I mean, I remember driving to the different doctors who were fixing, because it wasn't, implants then weren't like they are now.
Right.
And she came along. She first came COVID, and then she got cancer. And as it turned out, she couldn't do any of the things until sometime this year. And when she went to the dentist, and I was really pleased with them. She's an MD and a DDS, and she's her board's in oral facial maxillary surgery. And she said, you know, the post in there may not be all the way in the bone. Yeah. What? Because that's what they're supposed to do. It's supposed to be into the bone, the little post that they hook the implant on.
But the way they measured it with x-rays back then is
It could have
different.
been. Right.
Now they're doing digital x-rays. It's much clearer. They can.
Right. And she said, you know, if I take that out, we're going to start all over. And if it's not in there all the way, it's not going to be, it won't be tight. And so she ended up putting a cap over it.
Mm-hmm.
And that was the easiest thing to do. But I think it's important that people, I mean, I would have had no idea about that post if the doctor hadn't said that.
Mm-hmm.
I mean, it's in there and it goes into the screw and that's it. And it's good that you got somebody that would tell you that information.
Well, yeah, and dentists aren't necessarily going to tell you. They won't even tell you that silver fillings are bad for you because they're worried they're going to get sued. Why did you recommend them in 1900? I mean, you know, it's just crazy. So the technology, though, now is evolving so quickly. We can see so much. In fact, I am very against root canals because root canals have a lot of little vessels, little blood vessels that they can't get into manually. And so that bacteria that caused the tooth to die, the tooth, you're not saving a tooth with a root canal. You're saving a corpse. You're allowing a corpse.
So what should you do instead of a root canal?
Well, I take it out and either put a bridge or an implant in it. Just not a root canal. Don't try to save a tooth with a root canal. It's dead already. But the problem is that that's why I don't recommend it, is because that bacteria can fester. And now they pack the packing into the root canal to fill it. And it just festers. 5 years later, you've got chronic fatigue syndrome and you don't know why. And they take that tooth out and they find all kinds of horrible diseases, bacteria in there. So, but there's a man in Scottsdale, Arizona, who's working on a laser, and the laser will get in there and kill the bacteria. The laser, there's nothing that will stop the light from going into the tiniest of blood vessels. So that's going to change my whole stand on root canals once that gets perfected.
How many doctors use the laser?
Well, not very many. It's still it's still being worked on. So, you know, it's new technology, but that's my point. The technology is moving so fast, and AI is driving it, but also just regular technology. Like now, you don't even have to send in. Sometimes you don't even have to send in
A mold.
A mold. They can just take a picture of it and send it into the lab, and the lab can make it perfectly, and no human hands touches it.
Or they have a machine there in their office.
Yeah, that's been around for a while, but some things should not be done there too. So it's hard. To your point, the average Joe Blow patient has no clue what's really going on in their mouth. That's why you have to be your own advocate. That's why you have to ask for these tests. That's why you have to ask, how much infection do I have in my mouth? That's why you have to use products that are not over the counter and have a whole bunch of, petroleum ingredients in it.
Right. Things you shouldn't have in there. What do
Right,
you think
exactly.
about fluoride?
Oh, you just want to get me in trouble. Fluoride is not necessary. Fluoride is, in my opinion, this is my opinion, and it's in my book. And the reason there's so many bad risks that you take with fluoride. But the problem was, if you didn't have fluoride in your toothpaste, then you would get decay. So that's why the Clean Kiss toothpaste, I put vitamin B12 in it, because vitamin B12 breaks down decay, breaks down sugar. No sugar, no decay. So that's another part of the Clean Kiss home care, is that you don't have to worry about fluoride because you've got vitamin B12 in the toothpaste.
So you're talking about essential oils, vitamins, minerals, the kinds of things that we talk about in our protocols.
And I did it before it was cool. It made sense to me.
It made sense to me back in the 70s. Well, not the 70s, but certainly in the 80s when I
Okay, you
started
trump
seeing,
me. You trump me.
since I started seeing the neurotoxic people, um, and those were people. The doctor that I was fortunate enough to visit and learn from, he was actually treating the farm workers in Southern California who were being sprayed with the fertilizers and the uh, uh, insecticides. And what would happen is they would get sick, and the farmer would send them back to Mexico,
Yeah,
right?
yeah.
And that's one of the reasons the guy came along for the farm workers to organize.
Are you
And
talking about Cesar Chavez?
yeah, Cesar Chavez,
I
right?
remember. I remember, and he got killed or buried somewhere. Nobody knows.
That happens a lot with people that go out and try
They're
to
so
organize
blameless.
people. Yes.
Yeah.
Um, so anyway, what I learned about that is you first have to open up the sewer, because you can't do anything until you open up the sewer, and then you have to build up the battery. And if you don't do that, you don't get well.
Makes sense.
It's just that simple.
Mhm.
And I talked with a lady earlier this week, and she went to a guy to another doctor that I worked with a long time ago, and she's a lot better. But the problem is when you go to these allopathic doctors that do environmental medicine, they're basically treating symptoms. And one of the things that I learned in my psychotherapy training, my psychoanalytic training, is when you get done with one problem, it's like pulling up a tissue, another one pops up. So why not fix the whole thing at one time?
Well, part of the problem with that's a nice thought, but part of the problem is that the body's constantly changing. So you think you can fix it all at one time. And depending upon how long it takes you to fix that, the body's already changed. The
Well,
body's not static.
well, that's true. But when you put into the body what is necessary for the body to heal itself,
Oh, you're talking about, yeah, why not do that? Yes,
yes,
absolutely,
right.
absolutely. I thought you were talking about repair. No,
No, no.
absolutely. There's two questions so before you do any dentistry, one is to find out how healthy your gums are. But the second one is to ask the dentist, why did I lose my tooth? If you don't put an implant in until you know why you lost the tooth that you're replacing. Is it because of malocclusion? Is it because of medicines? Is it because of periodontal disease? Is it? Is it decay? What is it? Until you know why you lost the tooth, don't replace it with anything because you won't know the way to go.
You're talking about malocclusion, And as a function of my muscle disease, masseter muscles are weak. I mean, in other words, if I chew gum, my mouth is going to start moving all over. So I don't chew gum anymore. But I'll notice that if I get tired, or if I got a piece of something I have to chew a lot, my lower jaw moves. The top teeth come down, and it cuts my gum. And
Well,
it's
it could
painful.
also be, yeah, it's painful. Of course it is. It also could be TMD or TMJ issues. So your joint, it could be your joint is slipping, and that could be because
It
of the.
is.
So what I would recommend for that, and I have somebody in Dallas that would be great for you. Is they build a night guard, a splint. It's more than a night guard, and it'll keep your alignment. It'll keep your joints, your TMJ joint in alignment, and so that way it won't slip as much.
Send me his name or her
Well,
name.
it's a him.
See
Yeah,
him.
yeah.
Okay. So anybody else have any questions they'd like answered? Any comments they'd like to make? Well, we still have a few minutes left.
Do you have any dental decisions that you're making?
I've got a quick question. So I've heard both sides of flossing. Flossing, we always told, is supposed to clean the bacteria from our teeth. And I've also read some things where you don't want to floss because that's the bacteria, you're taking the good bacteria out. What do you think about that?
I think that good bacteria, the amount of good bacteria that you're going to take out is negligible.
Okay.
And the only bad thing about flossing is if your teeth are tight and you can't get the floss down in there, properly. It can actually be painful. You can cut your gums doing that,
Okay.
But the other thing too is when you're flossing, you want to use mouthwash first to disinfect. By the way, don't ever use something with chlorhexidine in it.
Okay.
It's it's a prescription. It has to be written a prescription by your dentist, but it's known to cause heart attacks. Mayo Clinic did a study on it. And so there's no need for it. You can use Clean Kiss or ozone, at home ozone to keep that bacteria killed. And then you can floss to get the plaque off without worrying about the bacteria. Make
My
sense?
my uncle was a dentist, and he taught at Washington U School of Dentistry. That doesn't exist anymore, sadly. But he would say, now remember, he was old when I was a kid. So, we're talking about the 1950s. And he said, well, you don't floss because you create a film around your tooth that the bacteria prevents the tooth decay. So I don't know.
But when you use a water pick, you're not going to do that. If you use a hand floss, you might be doing that. So you might want to just use a water pick to get the bacteria under there. And you're not removing the film is going to have that's on your teeth reforms within hours. So I wouldn't worry about it, about
Well,
taking the good film off.
I don't floss. I just use a water pick.
Yeah, a water pick, and by putting the Swish mouthwash in, just a couple of capfuls into your water pick water, it gets it under the gum line. So, but don't worry about hurting your biofilm because of flossing.
And maybe that was some. I mean, he taught that dental school also.
Well, and
So
I'm not saying he wasn't wrong at the time.
at the
And
time, that's what I'm saying. At the
I don't even
time,
know that water picks were available at the time.
no, they weren't. No,
So
no,
you're
you
flossing?
you had to brush.
Yeah.
2 minutes brush. And
Any other?
then I also read that you really don't want to brush with soft bristles you're really better off to brush with hard bristles?
Again, that depends upon the person in a sense that soft bristles are usually now recommended over hard bristles, just the opposite, because the hard bristles can damage your gums. So it depends upon if your gums are healthy, hard would work. I would do hard bristles. If you've got bleeding when you spit in your sink and there's blood in there, you've got damaged gums, don't use a hard bristle. It should never hurt to brush your teeth.
Okay. Anybody else? Any questions? Dr. Grant.
Also, taking prebiotics, probiotics, and postbiotics will make a healthy gum, a healthy gut, a healthy microbiome.
Let me address probiotics, all the things that you're talking about. I do not believe in systemic antibiotics. Systemic antibiotics in the bloodstream constantly is not good for your system overall. So, because you build a resistance to bacteria. But probiotics, prebiotics, those are fine. But there's different types. I carry a probiotic that's just for the mouth. But there's also probiotics that are just for the gut. So you got to know what you're getting. You don't just go buy probiotics. You got to know what your goal is with them. But antibiotics, I highly recommend that they're a last resort because of the problem with getting a bacterial resistance. I actually wrote an article that was published in Dentistry Today on that subject a while ago.
They're not giving them out like candy like they were back when I was practicing in pharmacy. Everybody had antibiotics.
Yeah.
I mean, that was it. What's wrong with you? Well, I got a fingernail and you got an antibiotic.
Yeah.
My toe hurts. I got an antibiotic.
Yeah.
And then we ended up that we've got bacteria and funguses out there that we have nothing to fight them. The only thing that you have is what goes into your mouth and what comes out the other end, because it keeps your immune system functioning. And believe me,
knowing information, by the way, the Berkeley Wellness Center in University of
California.
California, thank you. They were the first to come out with saying inflammation is the root cause of all disease. So if you can control inflammation in your body, you're going to be healthy.
I'm glad they could say that. I noticed that, but I didn't know it was the cause of all disease. But I noticed that everything I was treating, once I took care of the inflammation, they all got better.
Right.
And I taught them how to keep from getting sick again by keeping the nutrition in their bodies. John, are you raising your hand? Maureen has her hand up.
Yes, John.
I'm sorry, testing my light. Sorry, Harvey.
Maureen, you're back. Hi.
Hi, sorry about that.
So you
I
can
just, with sugar. Oh, sorry, were you going to say, Leona?
I was just going to say, you need specifically to get an oral DNA test, and you should be able to get it from your dentist in Canada. That is, I think that is available there because my dentist.
I do have access to an oral physiologist, and actually I hadn't seen one for probably 20 years of my lifetime. He actually taught at the University of Alberta here in Alberta, and for pre-med and dental students, and he was a world specialist in TMJ.
Talk to him about an oral DNA test. It will measure the 9 bacteria. It'll tell you if you've got those under control or not. And that's the best
I'm pretty sure I do. I know the inflammation is caused from the connective tissue disorder. And I've tried everything to help it. What I was going to talk about though was sugars. Sugar is definitely, one of the things that causes inflammation in our body, especially the processed sugars. What I've done is I love to bake, and I bake with monk fruit, which is a sugar made from the monk fruit. And it does not increase inflammation. and it does not increase the sugar in your body. It is actually a really positive thing to put in rather than the sucralose and the fake sugars, which are really bad on the gut
Yeah,
microbiome.
that's definitely a good idea. Monk fruit is well thought of in all communities. Um, to bring that up, I use xylitol in my
I can't, it
toothpaste,
upsets my gut.
but you're not drinking it in the toothpaste. It should not do it in that. But the reason is because it builds the bone in the mouth, in
The
the
reason,
teeth.
sorry?
It builds the enamel
Oh,
in the
okay.
teeth.
Xylitol. Interesting. Hmm.
That's why I use it instead of monk fruit. That's the only reason. Yes. Who wants to go next?
Now John has the boogie, but I think anybody else have anything they want to say? I think we're pretty good. We'll be a few minutes early, but that's okay. It makes up for the times we've been really late.
Well, I like to be on time, and I'm glad you were too. So that's nice. That's awesome. Thanks for inviting me so much. And guys,
I go ahead,
get the
Michelle.
book. It'll answer a lot of your questions too.
It does. It really. I read it. I read it a couple of times, and I found it very interesting because there were things that, even being a doctor, I didn't know. You know, I mean, the explosion of information can't be in everybody. You can't encompass it all, for one person.
Right.
It just can't. And it's coming out. You know, we've got the technologies now, and that was a big thing. Was the technologies? We didn't have those.
Yeah.
You know, I was teaching a stock trading course down at the dental school, and our group met there on Saturday mornings. And I went back into their lab where they have all the old um, stuff that they use. And they had the one that was by springs, you know, it was wires and the drill, and it was, you know, it was on pulleys. It was electric. And the drill, and then they had the little ultrasound that they would use to clean your teeth. I mean, that's the kind of stuff. No wonder why I hate the dentist.
Yeah. Well, dentistry has come a long way.
It has.
And in some ways, and in other ways, it's still back in the Stone Age. You know what? It's very good mechanically and functionally, but not biologically. I teach dentists biological oral systemic health because they just don't consider biology in the equation. But that's going to change too.
Well, you know, it's interesting. They don't consider systemic biology in medicine either.
You know,
Right,
you're right.
Dr. Grant? Huh?
Yes,
Yeah,
absolutely.
they don't consider it then either. Well, and I'll give you, I went to see my doctor, the cardiologist, and he always asked me after, why are you here? Because there's nothing wrong with you. But I told him I had this thing on my foot, that on my heel, that was put there by a cardiovascular surgeon. Yeah, cardiovascular surgeon who was going to fix my knee. And he looked at me like, really? What is, and it was the way they ablate the nerves. It didn't work, but I figured I'd give it a try. But when he looked at it, this is what he said. Beautiful cardiologist. Right? I mean, I love this guy. I really do. He said, you really need to go see a dermatologist. You know, it's amazing, but you would think that the heart doctor, oh, he was a vascular surgeon. It was a vascular surgeon who did this, who did the little, they'd run a little thing up, and then they ablate your nerves. And he said, well, I don't know if they should have been doing that. I go, I don't think they do a lot of it anymore, but I thought I'd give it a try. Okay, thank you all very much. We had a wonderful meeting. You need to get Leona's book. It's on Amazon,
It
Diffuse
is.
the Dental Implant Time Bomb. Thank you, and we will meet again next week.